So I think you guys are aware, given the story behind AccuFix, that I had severe acne for a really, really long time. And I'm here today to actually get treated for acne scars. So acne scars के types होते हैं. There are, very simply, you have just discoloration and you have pitted scars. And pitted scars are typically really, really difficult to get rid of just with products. So skincare 100% has its place. But when it comes to pitted scars, you do need more invasive treatments. And what I like about Dr. Momina and Skin Studio in general is the fact that I don't think that any other place is offering the treatments that they're offering, which is great. So they have a super wide variety of treatments. And in all honesty, I'm not a fan of all dermatologists, but I really like her. But tell us a little bit about, sort of yourself and the procedure that we're going to do today, and what are all your targets, how it works.
So, my name is Dr. Momina Zaheer, and I've been sitting here at Skin Studio for almost 4 years now. Almost 4 years. So, I am a certified dermatologist, and I've done my training in aesthetics after doing my dermatology. So, what we're offering here as pertaining to acne scars from very basic things. Just like you mentioned, that there are marks and there are scars. For the marks, we're just offering peels. Just like you are using actives in your skincare. So we use a medical grade, higher concentration of the similar compositions of glycolic acid, of salicylic acid in doing peels for the patients for the active acne and the acne marks as well. As pertaining to the pitted scars, we are doing multiple treatments ranging from microneedling to laser resurfacing to TCA Cross, subcision, and RF Microneedling. It is my newest device. I've been very happy with it. I've been using it for almost a year now. And RF Microneedling, the device that we have at Skin Studio, is called Morpheus 8. It is one of the best microneedling devices in the world. The needles go inside your skin, they penetrate like this, and then heat and energy is released. The radiofrequency is released inside the skin tissue. It leads to collagen formation, it leads to elastin formation, so hence improving the scar. Whenever the scar is forming inside your skin, जब normal skin आपके नीचे जा रही होती है, what happens is that the elastic and collagen layout, which is like this, it forms in a zigzag manner. So you get scars on the skin. किसी को बहुत जल्दी scarring हो जाती है, किसी को बिल्कुल scarring नहीं होती है. It's just your genes, it's just your luck. And if you're picking on the active pimples, then you are actually making it worse. So what we do is with radiofrequency and microneedling, it is equivalent to good 2-3 sessions of a regular microneedling therapy that you get done. It is much more effective as compared to a regular microneedling. Yes, a bit pricier as well, but in the selected patients, well worth the money spent. So the needles goes inside. We put numbing all over face, जिस तरह हमने आपके face पे लगाई हुई है. You put numbing for around 25-30 minutes, maybe 40 minutes for people who feel a lot of pain, and then you do the needling. There is very little downtime to it. What I like about it is if you get it done today, when I follow up with you tomorrow, almost 90% of the redness should be gone by the time you wake up. So there is no social downtime. Like laser resurfacing has a social downtime of 7-10 days. But with this, even with TCA Cross, you have to be very careful for 7 days with sunblock, with everything. So इसके साथ once you get it done, एक तो scarring improvement, immediately you start seeing it within 3 weeks. And 3 to 5 sessions, there is almost a good 70-80% improvement. You can't get rid of the scars 100%. If someone is telling you that, they are absolutely lying to your face. Yes, you can improve that. Yes, you can produce more collagen. I've had cystic acne for a long, long time, and I've been working on my face for a very long time. The reason you don't see too many scars on my face is because I do all these treatments and procedures for myself maybe once a year, twice a year to maintain it. So maintenance is key with any kind of treatment that you are doing for pitting and scars. You get 3 or 4 sessions done, and then maybe once a year you start getting maintenance treatments done.
So how many sessions do you take annually with Morpheus?
So usually I tell after a month of doing the first session, this is what I'm going to tell you as well, but maybe 3, maximum 4. 3 to for sure.
1 month apart.
1 month apart, but 3 for sure. But how much improvement you see, that will be noticed within a month of doing the first treatment. Only then I'll be able to either increase or decrease the energy of the treatment, or tell you okay, what we can do, how many sessions do we require.
Okay, and are we going to do like, so for example, I know that sometimes combination therapies work the best. So is that something we're going to be considering in my case as well?
Not for the first time. I would just want to see how Morpheus works for you. But if I'm not happy with the way the Morpheus is working on a few deeper scars, then I might do TCA Cross, a little bit of subcision with a tiny needle, So for the first time, I would just want to do the Morpheus for you first. Let you see how that works out for you as well, right? So basically, let's do one because I haven't worked with your skin before. If I had been doing a couple of treatments for you, then I would have done a combination therapy, but not the first time. I don't do multiple treatments for a first time.
Perfect. Right? Yeah, makes sense. Okay, so I think I hope you guys got a good overview. So I'm just gonna, you're gonna get a chance to see the entire treatment, and then I'm gonna tell you about my experience after it, and also show you my skin anatomy.
Visual 24 needles that go inside the skin. This is a tip that we use. One tip is used for one person only. That's why I've written Yasmin's name on it. So this is the deeper one. Do you see?
The forehead was actually kind of worse.
So
because it's closer to the bone.
there is fat
Yeah.
in here. So what I'm doing is, the needle has gone inside your skin once, but I'm stacking the pulses on top.
Say
You see, needle once, 1, 2, 3. So I'm 80% done. 50.
Assalamualaikum everyone. I am back here today at Skin Studio with Dr. Momina, and I'm here for my second session. It's been pretty much exactly 1 month since I had the last one, and as you guys can see in the pictures, I think there is quite a bit of an improvement. So Dr. Momina said last time, whenever a patient comes to her for the first time, she doesn't experiment too much. She tends to stick with one procedure. So last time I only had Morpheus 8 done, and this time she decided to combine that with TCA Cross. So come along as I take you on my journey to getting rid of my acne scars.
You're alive.
Still hurting.
Here. Any better? This piece better कि नहीं? This piece better कि नहीं?
This piece.
Yeah, but this is very deep. This is like, let's say 3
यहाँ पे
times.
दर्द नहीं हो रही, उधर ज़्यादा थी, इधर कम है. अच्छा.
Keep icing the other cheek.
It's been 48 hours since I had my second session with Dr. Momina, and this time around she did the radiofrequency with a microneedling that was a lot stronger than what we said. And in addition to that, we also did something called TCA Cross, which we kind of showed you guys the process yesterday. So you can see I have a lot of marks on my face. These are basically scabs from the TCA Cross. And since we went stronger with the Morpheus 8 as well, even after 48 hours, I feel like I still have a tinge of redness, which compared to last time, the 24 hours के अंदर the redness completely subsided. But yeah, it's not. Other than the scabs, the redness isn't really noticeable. So as you guys know, second session के अंदर हमने we did Morpheus 8 with Dr. Momina, and उसके साथ we did TCA Cross on some of the deeper scars. So we went pretty deep with the Morpheus in the last session, and the plan was to see how well my skin tolerates it, and if it tolerates it well, तो third session में हम मज़ीद deep जाएंगे. But I think TCA Cross, I don't think it was the most effective. So for some people it is very effective, but I don't think it was the most effective treatment for my deeper scars. And with Morpheus 8, with like going deeper, one of the things that I personally noticed was that I got a little bit of pigmentation, which was very good to use our vitamin C, alpha-arbutin and niacinamide serum to get rid of it. But I did notice some pigmentation, so we decided that third session mein hum itna deep nahi jayenge. And instead we did two things. So we did CO2 fractionated laser, which is something I've had done before, and it's a treatment that I really think is effective. And we did that, and we stacked that with Morpheus 8. And with both treatments, we didn't go super deep. So as you can see, my skin right now, I got the treatment Friday night. Today is Monday morning. So I had these boxes, जो CO2 का basically जब वो आपकी skin पर आता है, so you have these little boxes with ... इस तरह से बना होता है. So unfortunately, I wasn't able to take a picture over the weekend to really show you guys, और अब वो pretty much clear हो गए. So एक आधा शायद आपको चेहरे पे नजर आ जाए. But that also tells you how quick how little the downtime really is and how quickly your skin sort of recovers. So I'm just going to take a picture right now to show you guys how my skin is looking in like a little over 48 hours.